A report found that a staggering 88% of adults in the U.S. find it hard to understand the healthcare system. With the annual enrollment season in full swing, now is the time to assess your coverage and find the plan that works best for you and your budget. Now, joining us now to discuss is Dr. Rhonda Randall from United Healthcare. Thank you for being with us, Dr. Randall. How are you?
I'm well. Thank you for having me.
So, Doctor, what and when is open enrollment?
Well, open enrollment season is among us. It's a time of year when millions of Americans are selecting their healthcare plan for 2025. And right now is a good time to assess your budget needs as well as your healthcare needs. It's important to know that that open enrollment period isn't the same for everyone. So there's important dates to keep in mind depending on your situation. If you're one of the millions of Americans who get coverage through an employer-sponsored plan, you generally are going to have a 2 to 3 week open enrollment period between now and the end of the year. Pay attention for those communications to come from your particular employer. It's different for everyone so that you're not waiting to the last minute. For Medicare beneficiaries, the Medicare annual enrollment period is about to start next week. That annual enrollment period for Medicare begins on October the 15th and it ends on December the 7th every year. And if you're shopping for an individual plan in the health insurance marketplace, for most states that open enrollment period is from November 1st through January the 15th.
Now, Doctor, what are some tips that can help people pick the right health plan for next year?
Well, the first thing is not waiting to the last minute. You really want to spend the time to understand your budget, your healthcare needs, and the differences in the plans that are available to you. The second one is understand those healthcare terms that you mentioned earlier. They can be confusing. So the differences between copays and deductibles and coinsurance and premiums. We put together 2 websites to help navigate the complexity and explain all of that information for you. The first one, the first website, justplainclear.com, and the website for Medicare beneficiaries is medicaremadeclear.com. Recognize a lot can change in a year. So your current plan might be meeting your needs. You want to make sure that it's not having any significant changes between now and next year that you need to take into consideration. Specialty benefits are another thing to look into. I'm talking about things like dental, vision, and hearing coverage. If you're a Medicare beneficiary, you might be surprised to know that Original Medicare doesn't cover most of those things, but many Medicare Advantage plans do. And also check for mental health care coverage. Behavioral health, virtual behavioral health has become very popular in recent years, and some plans might offer those virtual mental health visits at $0 copay.
Now, Doctor, one of the things we need to talk about is cost. Cost is top of the mind for many these days. Do you have any additional tips to help people find a plan that works for their budget?
The first one is pay attention to more than just the monthly premium. So that's the number that you're going to see coming out of your paycheck once a month or Social Security if you're a Medicare beneficiary. But you also need to look at things that you might be responsible for, like a deductible or a copay or a coinsurance. Make sure your doctor is in the health plans network. That can help reduce your out-of-pocket costs. Medications are an important one. If you take any medications on a regular basis, you're going to want to make sure that they're covered by your plan. And even if they're covered this year, the health plan's preferred drug list can change next year, so you're going to want to check up on that. And then last but not least, you might have an opportunity to get rewarded for making healthy choices. Some plans offer incentives like for completing a health survey or for exercising or for not smoking. You might be able to get a reward. And for some Medicare Advantage plans, you might have access to a free gym membership at no additional cost to you.
Now, where can we go for more information?
We have tips, resources, and information on the plans available in your area on our website. That website is uhcenrollment.com.
Been speaking with Dr. Rhonda Randall from United Healthcare. Thank you again for joining us on Morning Blend.
Thank you. Be well.